slides in the handout just to the list, but that way people could open themselves if that was possible. So anyway, my name is Dylan Burns. My role is Mental Health Services Director at Vermont Care Partners, and Vermont Care Partners is the trade association for the designated agencies and specialized services agencies in the state of Vermont. And so Melissa had reached out to us talking about how it might be helpful to talk about how to access mental health and developmental services in those agencies. So we put together some slides and thought we would just each spend about 10 minutes kind of giving a really broad overview of the services that you all could potentially refer the individuals that you serve to, and then also wanted to be able to answer questions about any questions that you might have. Does that sound okay?
Sounds fantastic, and I think that we've got you on now, so we should be able to, we've made you the presenter. If you want to share your screen, we should be able to see your PowerPoint as you go through it.
Okay, so I just need to open the PowerPoint, is that what you're saying?
Yep, you need to open the PowerPoint and then select Share My Screen. Click Show My Screen.
Okay. Sorry everyone for the technical challenges here.
No, you are fine. We just really want to see what you made for us, so we're willing to wait.
This is not on mute, so.
Okay, so the show here, just I click on that red button. Oh, I see. Okay. So can people see my screen?
Yeah,
now?
we can see it. We've got it. Yeah. Yay.
Thank you all for your patience. The other document that we really want to distribute that I'm not going to spend the time to get up on the screen right now is a one-pager that we have with a map of all the designated agencies and specialized services agency and intake phone numbers for both mental health and developmental services. And I think this could be a really, really helpful resource for you all. And we'll make sure that you get it, but I just don't want to spend the time to pull that up right now.
That's great.
Okay.
Thank you.
So we thought it might be helpful to just give a super brief history and context for designated agencies. So three themes here. One is that the community mental health centers were developed in the 1960s as part of I think Johnson's Community Mental Health Act, and the goal was to support people in moving out of institutional settings and being able to thrive in the community. And so over time, our designated agencies have grown quite a bit since then and developed, but I wrote the farmhouse model of growth, and what that means is rather than this one kind of overarching vision and plan for growth and development, the different services that we have added on over the years have been like a rambling Vermont farmhouse where you just have a little funding where you can put up a shed, and then you have a little more and you add a wing, and they may or not be all part of some clear cohesive plan, but they've all come up to respond to a need that has existed at the time. And so as we talk about what mental health and developmental services exist, that's just hopefully helpful context to think about why our agencies are organized the way that they are organized. And I wanted to mention that we're called designated agencies because we have a kind of a grant with the state of Vermont to provide a set of services. And unlike private mental health providers, we have a mission that means that we don't necessarily say no. We have to serve people, and we want to serve whoever we can within our capacity to serve people and within kind of both funding requirements and just kind of our programming. But that's what makes designated agencies different or unique from private providers. So I'm just going to go through some different kind of mental health services that we offer, and then Lynn's going to talk about developmental services that we offer. Crisis services are, I thought it might be, many of you may have helped clients or patients access crisis services, but you may not have either. We have 24/7 hotlines in every region across the state. Those lines are also on the intake phone number list you'll get, and those are screeners. Some of you may have heard of them, but we're obligated to be responsive to the mental health needs of anyone who might call in. They are screening people to check in about whether they're safe for themselves and safe for others, and so screeners can provide kind of phone-based supportive counseling to de-escalate people, that kind of things, and then screeners can also end up supporting people accessing hospital level of care if that's appropriate or necessary. I also put as the last bullet that they can be a resource for providers, because if you're working with someone in the moment and you're really concerned about their safety, or you think that they might be in a crisis, you should feel that you can call a screener and consult with a screener about the situation that you're in. I'm going to move quickly here. Maybe I'll just review a set of mental health services, and then I'll open it up for questions on any of those. So CRT and CST programs. CRT stands for Community Rehabilitation and Treatment, and CST is just another name for the same kind of programming called Community Support Programming. That's what it's called in Chittenden County and in Washington County. So that's for individuals who meet criteria for severe and persistent mental illness. The intake or eligibility process is a complicated one that looks at the individual's history and their ability to kind of function. But once someone is eligible, they are able to access a kind of whole set of services that would definitely include kind of service coordination or case management, probably includes psychiatric medication management, but then and kind of traditional therapies, but then it also involves access to lots of other support services such as job coaching and employment services, life skills support occasionally, and also in some cases like group home or residential options. Those are usually maybe if people are really unable to live successfully in the community and are moving away from like a long-term residential placement or hospital placement. But the goal of those programs is to support individuals in their recovery, and so some people access those services for a short time, but many are accessing those services for a really long time. So our adult outpatient and substance use disorder services are much, in terms of eligibility, they're much broader. An individual just has to meet criteria for like having a mental health disorder or a substance use disorder, depending on what service they're accessing, and that can look like individual therapy, but increasingly those programs also can sometimes provide some additional group work, for example, or service coordination. So, and then another feature of that kind of silo of our services is the elder care program, which I hope most of you have heard of and are aware of. It was designed for people who are homebound, elders who are homebound, and the referral process is, I believe, through the Agency on Aging, but it's an opportunity for therapy for elders. And I think and hope that in some regions there's also an opportunity for you guys to receive consultation from elder care staff just around mental health issues. And I know that there just might be differences regionally around your connections to the elder care program. And then in some of our agencies, but not all, we have medication-assisted treatment and kind of intensive outpatient addiction treatment. It really just depends regionally on that. And then I just wanted to also mention children, youth, and family services, because I imagine that some of the adults that you work with, who you're concerned might have kids and you might think they would benefit from having kind of parent coaching or family support. And so again, regionally, there are some real differences in our designated agencies, but Children's Youth and Family Services can offer things like home-based parent coaching, home-based counseling, case management that can help kids access things like summer camps, activity funding, case management that can help kids who maybe really have educational needs but aren't able to access that with helping develop a coordinated services plan and so on. I'm sorry, I'm not trying to throw out jargon, but my point with this is that if you're working with individuals who feel like could really use support for their child or for their kids, it's also a great opportunity to make a referral to your designated agency. So I'm gonna, I recognize that was really brief. Can I answer questions about any of the things that I just covered?
Dylan, I have a question. This is Melissa. I know that there has been some concern around CRT eligibility and needing to have a diagnosis from, earlier in childhood. I think that because of that, people have maybe been deterred from referring to the program. But I think, could you just talk a little bit about, it's better to refer and not be eligible because maybe there would be other services available than to avoid it because of eligibility concerns?
Yeah, I think that's a really great point. It's, again, just talking about how our services have expanded over the years, we do as a system, I think we're trying to move away from specific diagnosis or program eligibility and focus on what are the needs of the individual and can we serve them as a system. So Melissa, I think I totally agree that if you all recognize that an individual that you're working with has mental health needs, I encourage you to call the intake number and you can share that you think they might be eligible for CRT, and you might learn about other services that might almost look quite similar to CRT or CSP services in that it could involve a package that had things like therapy, psychiatry, case management, even if it wasn't technically the CRT program.
Perfect, thank you. Do we have anybody with questions on the chat or anything like that? Okay, so we don't have any other questions coming in right now. That doesn't mean that they won't, but we do have a bunch of people muted, and some use chat and some don't. So if you wanted to go on to the developmental services, that would be great.
Sure. So Dylan's going to put up the developmental services slide. My name is Lynn Cleveland-Vistum, and I just have joined Vermont Care Partners about a month ago as the Developmental Disabilities Services Director. Have a long background in disability work, both with the state and through private agencies. So when we talk about developmental services, the eligibility criteria is important because it has to have a diagnosis of developmental disabilities is a very specific diagnosis. And eligibility basically has several prongs. You have to be found eligible for Medicaid, and you have to meet the clinical diagnosis of developmental disability, which is two things. It's a severe chronic disability that manifests before the age of 18. That's an important aspect. And it results in an intellectual disability or a diagnosis of autism or pervasive developmental delay. And the deficits in adaptive behavior have to be at least 2 standard deviations below the mean for a normative comparison group. So the disability is severe enough to put the developmental scale, it's quite clear that they have to be 2 standard deviations below the mean. So that may, but again, like mental health, I want to say if you have concerns and then you're thinking that someone you're working with maybe has never been diagnosed, but maybe is a person with a developmental disability, it's always better to, call the intake coordinator, and just like on the mental health side, there is a process to go through. There is the community, the designated agencies and the SSAs have a process. They do testing to determine whether or not, in fact, that person is a person with a developmental disability. And I know that, for instance, I was down in Rutland yesterday. In the Rutland region, there are some residents at Sheldon Towers who are receiving services both from SASH and from the Community Action Program, or the designated agency in Rutland. And those services mostly are around targeted case management, which is, supports, information, referral, and sort of a minimal case management, but they do share clients between SASH and the local designated agency. So again, it's always better to sort of, if you have those concerns, to check in and see. I was also assuming that you may have had questions beyond just people with developmental disabilities. That you often will run into a younger person who is receiving SASH services, and they're receiving those services because they're a person with physical disabilities. And so my other two slides are more around some resources for individuals with disabilities, both in, the first one is Vermont Center for Independent Living, and I'm sure some of you worked with them. They run a lot of programs that support people with disabilities, both with intellectual and developmental disabilities and people with physical disabilities. And that support is everything from peer advocacy and counseling to they have a training toolkit for people who have attendant care providers. They have a home modification program, although I will say that home modification program usually has a tremendous wait list. But if it's something that you feel would help support someone in their own home, or that's worth investigating. The other resource for people with disabilities, both intellectual and physical, that I don't think it's thought of often enough is the Vermont Assistive Technology Project, which, full disclaimer, I was the director of it 15 years ago. And when people think assistive technology, they often think high tech. But when you're dealing with elders, with people with disabilities, there are also low tech assistive technology, things that can help people with their ADLs that aren't computers. They're not techie, but they are assistants, whether it's small tools to help people fasten buttons or zip zippers, or access their environment, or reach things on a high shelf. And the cool thing about the Assistive Technology Project is they have regional tryout centers around the state that you can go in and see things. They all have a limited borrowing capability. You can borrow things to try to test them out, and they also offer assistance in funding. So beyond just the designated agencies and the specialized service agencies, there are also resources out there that I wanted you to be aware of around people with all types of disabilities. But I'm happy to answer questions about anything that I've presented.
Thank you so much. We had one question chat in asking if there are support groups in the Burlington, South Burlington area for adults with autism that you're aware of? Off the top of my head, there's Green Mountain Self-Advocates, which is sort of statewide, and that's adults with intellectual disabilities and PDD, pervasive developmental delay, and autism. And they are a statewide agency, but they are based in Washington County. Off the top of my head, I cannot remember the name of the Burlington group, but that is something I can find out and I can get out to you. Because I think there is a self-advocacy organization. And that's really, when you talk about support groups for people with intellectual disabilities, they've gone from being called support groups to self-advocacy organizations. People learning the tools and skills to stand up for themselves, to navigate their lives, and to a full partner in their life and how things are going for them. So I will get that information to you. That would be fantastic. Thank you. Does anyone else have any other questions? I don't know if we need to unmute people or if they can just ask. Okay. I think you guys are unmuted, so if you have any questions, you can go ahead and ask. And if not, We will definitely get the slide deck to you with the follow-up information after the call. This has been so helpful, Dylan. Thank you, and thank you for your quick turnaround here this morning with your rush to get it on. Oh, is there more? Oh, no, I thought. Oh, okay. Do you guys have somebody else presenting? Where I thought you were done, and Stephanie thought you had another person. So.
No, there's just the two of us.
Okay. Sorry. No worries. That was fantastic. Thank you so much. I really appreciate your information, and it was really helpful.
This is Dylan. I just want to apologize because while I was talking, I forgot I was supposed to be moving my slides forward. So on some of those service areas, if people just want to let people know that there's a little more information than you have on your screen. So when you get those documents, it might be helpful to take a look at them.
Perfect. And then you'll send us that link to the other document that you were talking about that lists off all of the resources in the area?
Yeah, I sent it to Joanne.
Oh, we've got it. Yep, Joanne's giving me a thumbs up over here. We've got it. So we will include all of that on we send out a follow-up email afterwards to everyone that was on the call, so we will include all of that. Thank you guys so much.
All right.
You're welcome.
Thank you. Have a great day. Bye.
Yeah, have a great day. Bye-bye. Then we're going to go to Molly, do you have updates that you wanted to share? I wasn't sure, so I put in some time if you want, and if not, we can move right on to the open forum questions.
I just wanted to, one update. Hi, everyone. This is Molly. Great that we're all together this month. I just wanted, especially after this presentation, hearing from Vermont Care Partners, which is such a great organization around mental health services and developmental disability services, just to mention, and I think I've mentioned this before, but I go to a lot of meetings, so I'm not positive, but we are piloting a embedded mental health clinician program through SASH. We're very excited to get that funded by OneCare in August. And so what we're looking to do is, respond to what we've heard from you all about, some of the challenges you face with your participants that have mental illness or some crises around their mental health, and the challenges you've faced with getting them to the right supports for them. And so what we have done is worked with a small statewide group that included representation from the Vermont Care Partners to design a pilot where we would have a mental health clinician that is employed by the local designated mental health agency, to actually be located in our SASH panels. And so we got enough funding to try this out at 2 SASH panels, and we are in the process of further planning and refining, and we're working up here in Chittenden County to do the pilot first here, but it was planned with a working group that included representatives from other parts of the state as well, so that when this is successful, which we plan on it being, it's funded for just a little bit over a year, we're hoping that we'll be able to spread, in some way, this pilot of embedding a mental health clinician in the SASH panels with you all, with the SASH coordinator and the wellness nurse. So we are looking to start this pilot November 1st, and we are really, really excited about the potential to have a mental health clinician that will have that consistent presence in your SASH panel, in the SASH panel, just like you all have. And we really believe that will build a relationship much quicker, will allow for the mental health clinician to do one-on-one visits in people's homes, also do group support groups, group programming, and also provide really important consulting and coaching with you all, with staff on the site, to build up everybody's knowledge and understanding of how best to respond to mental health challenges that our participants are facing. So I just wanted to update you on that. We'll keep you in the loop as we nail down kind of the outcomes we're going to be looking at and get it started. But as I said, we're planning to start that up here at a couple of our SASH sites November 1st.
Great, thank you, Molly. So next, we had said this was an open forum call, so we did actually reach out and ask for you to send in questions, and we did receive a few. So we're going to go through those now. The first question we got was about volunteers, how to recruit and retain them. So we dug up a PowerPoint that we had used several years ago that I think still is relevant today. So for volunteers, it takes time to save time. So I don't have enough time. I'll delegate some of it. Nobody's competent. I'll coach someone, but I don't have enough time. So invest time to save time. So sometimes, finding those volunteers can take some time or effort, and keeping them is also sometimes challenging, but it's an investment in saving time. Investing in volunteers can be beneficial on many levels. So like we said, it saves time after the initial assessment. It supports programming. So SASH staff aren't always available to do programming, and I have to say, some of my favorite stories that I hear from people are how they had a really successful program going, but they were kind of ready to end it, and the participants weren't. So they found someone in the group that was willing to keep it going. I'm thinking of Zen Tangles, Andrea Bebo. But, there's plenty more stories like that where it was like, okay, well, we did that for 6 weeks. That was the plan, and we were ready to end, but they weren't. So that might be a great way to keep a program going, is to find a volunteer. That way wellness becomes a shared goal between SASH staff and the participants, and it creates opportunities for sharing ongoing community programming. So it's a benefit to individual SASH participants as well to be a volunteer. So volunteering increases self-confidence and purpose. Focus switches to what can I give instead of what can I get. Highlights the strengths rather than the limitations of individual participants, and it fights depression and loneliness. One of my favorite stories here was Diana Rule down in Virgins had a person that needed help with reading labels at the grocery store. I'm probably going to get this wrong, Diana, and I apologize. But it was a visual impairment issue. She couldn't read the labels on the boxes at the grocery store. So they found another SASH participant to go to the grocery store with her. And not only were they both benefiting from this, they ended up being really good friends and doing all sorts of things together. But it started by having a volunteer take her to the store and help her read those labels. And then it's a benefit to the SASH panel and the surrounding community. It builds capacity from within a community to move towards self-reliance. It builds a sense of responsibility and ownership in the well-being of the community. And it's contagious once it gets rolling. And I'm kind of like, this one just got me thinking about all those walking groups everywhere. I know that those have movement of their own, because the SASH coordinator may not always be able to be there, or may not have, the ability to go out that day. They might have had a call, they got called away or something, and those people are still out there doing those walking groups. They're plugging along. And that's, without even thinking about it, that's volunteering. Somebody somewhere is taking the lead on that and getting that group together, getting them going. So I think that we see volunteers throughout our panels all the time, whether we recognize that it's a volunteer or not, is another thing. And so then building your volunteer base, resources for recruiting volunteers, clearly your residents are, your first go-to. There's also the United Way, the Front Porch Forum. Also, Front Porch Forum, Paul Hawkins, who uses this fantastically, you can get anything from there. He got greeting cards off of Front Porch Forum. They wanted to be able to send their participants birthday cards, but they didn't have it in the budget. So we put a request out on Front Porch Forum asking for greeting cards, and they got boxes. So, I mean, just things you wouldn't even think of. I know that there, and I can hear Paul in my head, there's so much more that he's done through Front Porch Forum, but that one always sticks out to me as something I just never would have even thought to ask for. And our volunteer coordinator. The AmeriCorps Vista, the university colleges and high schools, I know that we've got high school students cleaning windows all over the state. Sports teams and clubs, hospitals, large and small businesses, and then also your organization and their families. I know at Cathedral Square we've made a mission this year to do volunteering, so we're doing it at our sites with like cleanup days or you name it. They've done some really fantastic things. Did they do a walker wash? Yeah, it was like a car wash, but it was for walkers. It was great. Creative ways to attract, engage, and maintain volunteers. Written requests for volunteers should speak to the volunteer, make it relatable and personable. So, for example, wondering what to do with all those skeins of yarn? Answer, start a knitting class. Miss spending time with a very special family member? Answer, spend 1 hour, one afternoon a week with a senior who's missing his or her family. Those are great. Good suggestions. And then use simple, eye-catching yet descriptive wording. Looking for a person to prepare healthy, light meals, snacks that can easily be frozen. Example, are you the next Ina Garden? I don't know who that is. If so, we have some very appreciative folks who would benefit from your talents. I hope somebody out there gets that one, because I don't, but that's great. I always say Charlie Nardozzi. Like, do you like gardening? Are you the next Charlie Nardozzi? Come help us. So keep in touch with your volunteers, maintain regular contact and volunteer recognition. I mean, if you have a budget that allows for it, an event would be great, but even just simply a card that maybe you got donated from Front Porch Forum, but just saying thank you, or a personalized card from the person that they're volunteering for, all go a long way. And then, the other thing that would be really cool, highlighting them in your beat. Sorry, but take a picture if they'll let you, and recognize them in your beat. That wouldn't really cost any more than what you're already doing, and would make people feel really great. Successful volunteer requests. Oh, we know who Ina Garden is. Okay. A great cook. Okay. So include details when you're making a request, and make sure that they're relatable and personable. And then the nuts and bolts, the process and the paperwork. So volunteer application, you might want a criminal background check. So your organization likely has an account that they use for employees, and you could ask your supervisor for assistance and approval of the $15 fee. The Agency of Human Services Registry check release form is online, Vermont Adult Abuse Registry, and then a reference check. So those are the things that we would recommend using for volunteers. And that's it. But I saw a ton of chats come in, so maybe we could go through those. We might have hit on a hot topic. Okay. Yep. So, and then also at Cathedral Square, we have a volunteer recruiter, somebody that we've given time to help us do this work, and it could be a full-time job for her, I have no doubt. And then Ina Garden is a great cook and has a show. Okay. Thank you for clarifying that, Amy. Are there any other questions about volunteers? Any other thoughts?
I just want to add, this is Stephanie. I'll just add one thing. So this question does come up often. This is a slide presentation that was made in 2013 and was done on a SASH coordinator call, but it's great for it to be refreshed and do this. And what often comes up is just that last part around the forms. I mean, I think all of it is really good to be creative of how do you find volunteers, how do you use them. I'm trying to remember something that's come up too about not even using the word volunteer. For some reason, sometimes that works well, but sometimes there's more creative ways to phrase it. And our volunteer coordinator, Beth Alpert, might have ideas, or just any of these SASH coordinators out there. But this generation tends to be great about it. The one thing about the actual forms, you just have to check with your own organization, because every single housing organization is going to have different rules or policies. If it's, it may be different if it's a resident, so like that reading food labels, 2 residents going together, I don't think you have to worry about the vulnerable population rules, because they both pass whatever it takes to live in the building. So that's probably less restrictive. But if it's anyone from outside of the building, you need to check with your own housing organization to see what's required. So we can't, as SASH administration, say what's required for your organization, because they're all going to be a little bit different, or which forms. We have in the past shared the volunteer forms that we use at Cathedral Square, because we do have a pretty formal process. So we're happy to share those with you if you'd like. We can send them out with the follow-up from this call. And then if it makes it easier to share with the folks at your housing organization to model those after, anyone's welcome to. But we know several different housing organizations have different policies around outside volunteers. So I just wanted to add that, because I didn't know if that's what prompted the question.
Perfect. Thank you. Great clarification. So I was just looking, the next question that we had come in was about asking if the workflow for the assessment remained the same with PHL as it has been previously. And so I did ask for some clarifying information on that question, and I'm not sure. I sent that out really late last night, so the person may not have gotten it yet. But if you ask that question and you want to help me understand more, you can chat in or talk in. But I think what it is it was always pretty clearly broken out where it was the SASH coordinator assessment, and, you know, those were the first 4 pages or whatever, and then the rest was the wellness nurse assessment. And I think that the question is, does that remain? Is that still the same? And I know in PHL that there is a section labeled SASH coordinator assessment, and there is a section labeled general health assessment. So you would do the same. The question may be coming across for the workflow on the paper assessment. And what I can tell you about the way that was determined is it was meant to follow PHL. So all the tabs across the top on PHL line up in order on the paper assessment, and that might be where some of the confusion comes in. So I did actually create a little, I was trying to find it now, but if I can't, I will just send it out after this call. I went through and highlighted on one of the, oh, you know what, Joanne, I have it. If I send it to you, could you open it? It's hard to see, but I highlighted a printout of the SASH assessment and highlighted who should do what part. So that might be something that people would find helpful. I'll send it, Joanne can open it for us and we could take a look at it. It may not work. Oh, yeah, it might be too hard to see. It's small. So, and I can send this out with the follow-up email. But so in yellow, those are the things that only the SASH coordinator does, which is the SASH coordinator assessment. And then all the blue things are meant to be the things that the wellness nurse does. And then the green are the ones that either can do. So things like the Lubin, the social connectedness, the falls history, the Columbia suicide screen, and then the ones that were kind of grayed out there are going away. So if this is something that would be helpful, we can certainly send it along. Nothing has changed about who does what in the assessment. It just might be a little bit different kind of workflow or where to find it in the paper assessment that's changed. And then with that, I'm going to actually, we'll send the rest of the time over to Stephanie to talk about PHL because we did have a couple questions coming about that. One was, when are the PHL help videos going to be available? And the next was, where do we document about trackable activities, things like falls and advanced directives? But I suspect that there may be more that we need to talk about PHL or questions that might come up. So Stephanie, do you want to sit here so people can hear you?
And I'm probably going to, not to confuse you guys, but Madeline has been doing an excellent job handling all of your guys' PHL questions and working on it because I've been out for a little bit. So I'll do that. As far as the training videos, like Madeline and I both, those are nowhere near being ready. Basically, they have this whole library of training videos that could be uploaded instantly into our system from what they say, but they don't apply because they've made so many changes to PHL for the SASH instance, so I don't think they would be helpful at all. That's why there's no videos in there, because they don't actually match what we do in PHL. So I think that they're nowhere near being ready, and I think it's not the highest priority. And I guess I'm curious if people are looking for additional training tools beyond the desk aids for certain things. I know that new referral process is a pain. That would be my bigger question, is are you looking for more training tools besides the recorded webinars and the desk aids? Anyone, is there something that we can do to help you? Because I think what we can do is produce it ourselves or come up with something ourselves. Amy and Madeline are fantastic at that. Does anyone, what can we do to be more helpful with some of the stuff you're working on right now? Just let us know, and I would say let Madeline or Amy know, and we'll get that out to you. So training videos are not going to be ready anytime soon, so don't hold your breath. But if you are struggling with any of the current functionality that you're working on and just, you know, feeling like that desk aid is not, you need more than that, or if you want some more one-on-one instruction, Amy is here for you. She can definitely do that for you. She can do a one-on-one webinar where you're sharing screen. She can watch you do things, and depending where you are, she might be out in the area and be able to sit with you on it. So definitely contact Amy directly, Amy Rogers, and she can do as much one-on-one training, you know, as you feel like you're needing if you're struggling. Because we know that not everyone learns well in a group training or, you know, by watching a webinar. It's hard, and a lot's changed. So we're here for you. And by we, I mean Amy. Amy just chatted in. You can say, you know, Amy is here, yeah. Okay, so it sounds like one of the other questions, and you guys can feel free to ask, was about falls. Do you want to answer, Madeline? Or do you want me?
Before you go there, Stephanie, I unmuted myself with Amy.
Okay.
I just typed something in there. I just wanted to mention that for people to keep in mind, I'm more than happy, as Stephanie said, I would love to come out and train you. Just let me know or call me. I mean, anytime. I'm here. I've done it for lots of folks. The desk aids get updated. So I encourage you, we try to send out emails and let you know when they're updated, but we started putting version numbers at the bottom of the desk aid. So if the one you are working from does not have a version number, check back to the SASH forum for ones that do, just to make sure you have the most current version. We've also added a desk aid on creating notes that is now in the SASH forum. So if you're having questions about creating notes and some best practices, I would encourage you to check the forum for that.
Perfect. Thank you, Amy. So as you guys can tell, definitely reach out to Amy if you are stuck and you want training, you want help, you're struggling with the desk aid. She knows where they're at. She knows what's going on. And she is helping lots of people one-on-one, so she is there for that. Perfect. And Madeline's been helping everyone with technical issues and confusion on that. I may be punting too soon to Madeline on the, I'm here for like workflow issues. On the falls question, I think really nothing's changed. Let's see what time it is. As far as documenting a fall, I'm tempted to pull up PHL really quick. Really nothing's changed. If you wanted to document that someone fell, there's a specific tab just for that, and it's called Falls History, and it just has those 3 questions on it. You know, was there a fall? What was the date? What happened? Or I think it's just date, disposition, and cause, whatever it is there. Those standard things that can be documented by a SASH coordinator or a nurse. I'm not sure if I'm answering the question. I don't have the questions in front of me. Where should we be documenting? Oh, notes on trackable events such as falls and advanced directives. I really think for those of you who were here when we had DocSite, what we learned is if there's a separate notes box in individual sections, and here they're called tabs, in DocSite they were called surveys. If you put a bunch of specific notes in individual tabs or sections, they're going to get lost. I would keep all your notes in the main notes section. And then, you know, let's say someone's on vacation for a week, they come back, they want to see what's been going on with a person. They're going to look at the charts at the top of the screens, but they're going to read through the notes and see what happens. I really think that putting notes in specific tabs, they're going to get lost, and they're also going to be tied to that date of a visit. So really anything specific. We up here, but people ask us, do you need to audit my notes? Are you going to be looking back at them? What do you need for reporting? I can guarantee you we are not ever going to use your notes for any kind of reporting. It's impossible. The notes are for you and your team. What do you need to communicate to best help that participant? So that's how you want to think about notes. So I would really strongly recommend you just use the main notes tab. Otherwise, things are going to get lost and you won't know where to look for them. You'll get frustrated. But I can let anyone else on the phone feel free to chime in if you have a different workflow. But it's really, that's up to your team. You can, where you put your notes can be up to you. My recommendation is the main notes tab, but if you, a SASH coordinator, and you and your wellness nurse want something different, that's fine as long as you both know. So that's up to you. What I would say is how you write your notes is not completely flexible, and there is some upcoming training on that. Those of you who've been here a while know about this. Is, you know, notes cannot be subjective, and they, you know, need to be date stamped and all of that. So you just want to provide some caution around that. So I think we have one chatting question, then I'll let anyone who wants to comment or add to that add in. Should we put a header at the question is, should we put a header at the beginning of the note that there was an advanced directive done or referral done, I'm afraid this info will get lost in all the other notes. Yeah, I mean, I think, again, that's really up to you and your team, depending on how you write your notes. Hopefully your notes are not like 5 paragraphs long. You want them to really be concise and just the most salient information for that date and time. But I think when you make a note, if you want to put advanced directive, started process with Stephanie today, she wants to talk to daughter, we'll check back in 1 week. That's great. Whatever works for you. I don't have any rules around that. It's really what's going to work for you and your team.
But then once this is Molly, once the advanced directive is done, then there is a tab to show that it was done, right? That we document that we've completed advanced directive.
Yeah, and I'm right. Yeah, I don't think the question's around the clicking of the box to say it's done. Am I correct in understanding that? You guys don't have questions around the checkbox of the advanced directive was completed, but you want it in your notes. And also, what's really tough for you guys, I'm empathetic to this, is what's hard to envision, especially if you've never worked in DocSite, which was the last time we actually had a true database, because REDCap was not a real system, is that once we get all the functionality working in PHL, there will be a report, a one-click button that has a pie chart on it that says advanced directives, and you'll click on that button and it'll show you what percentage of your people have an advanced directive and what percentage don't. And if you want to click on the people, let's say, who don't, because you want to increase your percentage, you click on the piece of the pie that doesn't have people who do not have an advanced directive. You'll click on that pie piece and it'll take you in and give you a list of the people who do not have an advanced directive. And then you can say, oh, I want to do some outreach to these people. And you might know for sure that 5 of those 10 people are never going to do it. That's just who they are. But the other 5 have been on the fence. And then you can go talk to them. That's how these systems are actually really beneficial and work in your favor and save you work. It's just been 2 years since you've had that kind of system, and PHL isn't there yet. They're still developing some of those pieces, and they're developing much slower than we had hoped. So that is what you have coming in your future. Does that help somewhat? Okay, other questions? Okay, good. Anything else on PHL? I think I don't want anyone to get too frustrated. I would encourage folks that just to keep going and try and use it, really start using it and entering what you can, just chunking away at anything you have in paper. For the folks that you have there, I would enter as much as you can. Don't keep waiting. It's working as best it can right now, and I would just keep entering data just so that you don't get rusty, you don't wait, and then new features will keep getting added. But I would just start using it and entering things for the people who are there. And I'm just going to ask Madeline, do you have an update? You probably don't, on the exit. I know the exit works sometimes and not other times, and it's a complete mystery to PHL and us, but do we have an update on that? No, still working on it. We have no update. I will remind everyone that there is a PHL question and answer call that will be led by Madeline with Amy as backup next on Tuesday at 9 a.m. And that's really just for you guys to ask questions, anything you want. They can walk through steps, and Madeline and I are really going to try and push PHL to have that exit fixed by then so that you can clean up your caseloads. And I know that people, Madeline, have you heard from mostly everyone about any participants they need you to work on getting cleaned up on their panels? Not everyone yet. Okay, so if you've not gotten back to Madeline about any participants you need taken off your panel or help with, that there's a problem with, please get back to Madeline ASAP, because she and PHL are working to get your caseloads really clean. Okay, I'm doing a note, if it's not a visit, but we're entering data, what should we enter? Emily, can you give me an example of what you mean? Give me an example. You can talk if you want. You can. Yeah, so basically you know that the person had a transition of care. So they went into the hospital. So I would put, I'd probably put there's SASH, I wish I had it up in front of me. It's either there's a SASH coordinator visit or there's transitions of care should be one of the choices. And then pick whatever fits best under that. Oh, Madeline's lending me her computer. Okay, good. Let me just look. So let me see. And really this is, we tried to make it so it's a visit. So I would say, so the visit type, you know, maybe, I mean, I think by saying SASH coordinator visit, I know you didn't talk with them, but it's really being entered by the SASH coordinator visit, and then definitely transitions of care is the more important part there. But the reason you're making this note is because the person had a transition of care for the visit reason. Does that work for you guys? Do you feel okay about that? What about talking with a case manager? It's care coordination. So I still put SASH coordinator and care coordination. Yeah, it's because you guys are not actually visiting the participant. You're just doing work related to the participant. Am I understanding that correctly? That's kind of what it is, that you weren't actually sitting with them. I think it's fine. It's still related to them. It's work related to that participant.
We still want you to set up a new visit because it'll tie the correct date to whatever you're putting into PHL, and so that date field is really important to us. So try not to think of it as a visit, like a face-to-face or one-on-one visit. Yeah, that word isn't very, very good for what we're doing.
It's really an encounter. It's a piece of work with your participant, whatever that is.
Yeah, and we're out of the evaluation phase. Really, we're not looking at data on evaluation. I think at some point we might still look at how much care coordination effort was put into this particular person, but we're not specifically looking at did you have more of a benefit with a person based on the number of visits. It's really the amount of effort, care coordination effort put into a person. If we do choose to look at the data in that way, it's not going to be split out by how many times were you in the person's home versus not. Other outcomes that we better look at is if they attended a CVS-MP versus not. But it's really the amount of effort around a person. So I think of it that way. And we can look at changing that terminology, but it's already been changed. I'd rather leave it for a few months, let people use it. But I think it's good feedback to think about how to change it. Before we had home visit versus office visit, and otherwise you guys are going to end up with so many different variables. So just think about it, was it a SASH coordinator or a wellness nurse? And then there's group programming, team meeting, or exiting. Does that feel good? Okay. All right, so we're going to leave it there, but these are all really good questions. So Tuesday at 9 a.m., there'll be a lot of time, and PHL will be up on the screen, so you'll actually see it happening. If you know people who weren't on the call that want to see some of those slides from the developmental disabilities from the Vermont Care Partners folks, feel free to let them know. But we'll send out a follow-up email, and we'll hope you guys all have a great day.
Thanks so much, everyone.
Yeah.